Hello cyberji, welcome to Click Mind. Today, ubji will share to you about a rare disease that might intrigue you. It's a disease that makes patients can't feel pain. Meet Shiva, a 3-year-old girl who never cried. When Shiva was born, her mother noticed that this girl is very unusual. Unlike her siblings, she never cried. Normally, baby will cry because of hunger, uncomfortable, sick, or pain. Fortunately, her mother always fed her regularly, so she isn't malnourished. Although it seems like Sifa is a low-maintenance child, it's actually very hard to take care of her because she frequently gets high fever that will lead to seizure. When she was teething, she always bit her finger until her bleeding. And the scariest part is when she fell from the stairs and broke both of her legs. She's still smiling like nothing happened. When her parents brought her to the hospital, doctor realized that this girl is not normal, so she went through a lot of tests to finally get diagnosed with congenital insensitivity to pain with anhidrosis or CIPA. CIPA or Hereditary Sensory and Autonomic Neuropathy Type 4 or HSAN IV is a rare autosomal recessive disorder of the nervous system which prevents the patient to feel pain and differentiate between temperatures, and also prevents them from sweating. It's a very dangerous condition, and majority of the patients die before the age of 3. Why it's dangerous disease? Because humans need pain. As much as we hate pain, we actually really need pain to survive. Pain is like alarm to our body. When we feel pain in our chest, that means something is wrong with our body. It could be something is wrong with our lungs or heart. So we go see doctor to check on our body to get it fixed. So pain is helping us to give alarm to our body before the condition get worsened. When we feel pain because we burn our hand, we learn that it's dangerous to touch hot things. By feeling pain, we protect our body from harm. For patients with CIPA, they can't feel the pain at all, so they don't know if they are hungry, burned, bleeding, unintentionally bite their tongue, broke their bones, and heart attack. Without the alarm, it will be too late for the body to get it fixed, or worse, they could be die even before getting the treatment. Cyberji, these are the clinical findings on CIPA patients. For infants are biting lips, tongue, and fingers, and also recurrent fever that will lead to seizure. And for older patients, repeated traumatic injuries like bruising, bone fractures, and deformed joint or charcot joint. History of accidentally get burned, impaired visceral pain, they won't realize if their appendix is infected or burst, or if they got ulcers on their stomach. Can't differentiate between hot and cold substance. Most of them have intellectual disability. Wow, it's really scary. Is it contagious? Don't worry, it's not contagious. CIPA is an inherited disease, and the patient got it since they were born. The child has to inherit the CIPA gene from both of parents to have this condition. If the child only got one CIPA gene, the child will be the carrier of CIPA. CIPA is caused by genetic mutation, NTRK1, causing defects in the development and function of nociceptive reception or the nerve cell that responsible for transmitting signal of pain, heat, and cold to the brain. So when CIPA patient got hurt, they won't feel it because the pain signal is not transmitted to their brain. Anhidrosis is an ability to sweat. Sweating is important to regulate body temperature. Sweating allows heat to be released from the body. When body can't release the heat, it will be overheating. That's why people with CIPA frequently get fever and seizure from high fever. Can CIPA be treated? Sadly, there is no cure for CIPA. The only thing that people with CIPA can do is living as safely as possible. Avoid injury by being very careful and modify the activities so they can prevent themselves from accidentally getting injured. For a baby with CIPA, To prevent injury from accidentally bite lips or tongue, the teeth should be extracted or using mouth guard. Regularly check body temperature to prevent hypothermia or hyperthermia, and avoiding hot or cold environment. And also regularly check physical body to find if there is any injury. The parents should teach the children with CIPA to live with their unusual condition so they can live as long as possible. CIPE patient doesn't live as long as normal because they are high risk of getting life-threatening injury. The life expectancy of CIPA patient is no more than 25 years old, and most patients died before the age of 3. Cyberji, although pain makes us feel suffering, but pain helps us to stay alive. We really hope there will be cure for CIPA patients soon, so they can live normally. Or maybe their unique gene might help researchers to find treatment for patients with chronic pain in the future. If you find this video interesting, please give us a like and share to your family and friends. And if you are new to this channel, please subscribe for more videos about health and mental health. Thank you so much and have a good day.